there's a real misconception out there that all physicians are bad or don't care. And I can tell you that's not true. Less than 30% of physicians currently belong to the AMA as an example. 29% exactly belong to the AMA. So you have, 71% do not. They all are, though, very fearful of losing their position, their license, their livelihood. And it has become virtually impossible for them to even bring up alternative methods of treatment. There have been a few states, like Florida as an example, passed a law that allowed the physicians to discuss alternative treatments with their patients. But it actually had to be written into the law, and it specifically did not deal with cancer.
Okay.
Once you're diagnosed with cancer in this country, you are well and truly screwed, because every symptom you have from that point forward will be attributed to the cancer. Oncologists are probably the worst trained physicians as far as clinical medicine that you'll ever see. They are trained specifically, most of them come out of serology. They're trained specifically on pharmacognosy of cancer drugs, and they're never taught to look for cause or causative factors. And that's their education. If you develop cancer, as an example, you want a physician that can get to the root causes of the failure of the immune system. There are a specific series of tests that should be run because so many cancers, as an example, are estrogen sensitive. And right now we are inundated with estrogen. Our pesticides are estrogen based. That makes it impossible for the insects to reproduce. That was the purpose. Birth control pills, flushed out of the system, flushed down the toilet, go through the water treatment system, and are never taken out. When you're drinking city water, you're drinking water that are never tested for the chemicals that are there that could do you harm. They're tested specifically for coliforms, as an example, which is a bacteria found in human feces. But they don't test it for mercury. They don't test it for lead. They don't test it for estrogen or many, many other chemicals, fluoride, that can be carcinogenic. So once you are diagnosed with cancer, it's very important that you make every effort to get back to your general practitioner. Say, I will sign any release form possible that you would require to give me a better quality of life because I have chosen not to undergo conventional therapy.